Hello everyone, welcome to Logic Medico. Today's interesting topic is trachea. We are seeing the trachea in the superior mediastinum of the thorax in the cadaver. This trachea, will know the anatomy and physiology of trachea in this video. So the trachea is also called the windpipe. It is 10 to 12 centimeters in length. The internal diameter of the trachea is 2.5 centimeters to 2.7 centimeters. The trachea is a fibrocartilaginous tube. The anterior wall of the trachea is made up of approximately 15 to 20 C-shaped cartilage which gives structural integrity to the trachea. They are called as tracheal ring. In fact, they are C-shaped and they are incomplete on the posterior plane. This posterior plane where the C-shaped hyaline cartilaginous ring are there are completed by a smooth muscle which is bridging the posterior edges of this, and the smooth muscle is now termed as trachealis. This trachea forms the lower respiratory tract. The extent of trachea, it begins at the level of the neck, lower part of the neck, from the level of larynx to the level of two principal bronchi. You can see the right principal bronchi which is big and the left which is long and narrow. So the extent of trachea is from the larynx, lower part of the larynx, to the level of the two principal bronchi. If I talk about the vertebral extent of the trachea, it extends from the C6 vertebra in the neck, lower part of C6 vertebra, and in the thorax it ends in the angle of Lewis or the sternal angle, which passes between the T4 and T5, the disc between T4 and T5 vertebra. The function of trachea is mainly, so this is trachea in basically the gross anatomy of trachea. The length 10 to 12 centimeters, internal diameter 2.5 centimeters. It's a fibrocartilaginous tube. It forms a lower respiratory tract. Extend from the larynx to the principal bronchi, that is from C6 to T4, T5 vertebra. And the blood supply of the trachea is by the inferior thyroid artery on the mediastinal artery. The venous return is by the inferior thyroid vein and the mediastinal veins. The lymphatic drainage is pretracheal lymph node and paratracheal lymph nodes. The lymph nodes in front of trachea is called pretracheal, and by the side of trachea is called paratracheal lymph nodes. So this is about trachea in detail, anatomy of the trachea. Okay, now moving on to the physiology of the trachea or the functional aspect of the trachea. Trachea basically acts as a tube, as the name suggests, windpipe. It helps in transport of the air in and out of the lung. That is a main preliminary function of the trachea. The other functions of the trachea includes it protects the lower airways by having one reflex called as cough reflex. Irritation of the mucous membrane of the trachea results in cough. Cough is a protective reflex. It clears the mucus and the foreign body from the lower respiratory tract. So that is an important function. In addition to transporting air, it protects the lower airways. It also, the mucous membrane of the trachea has got rich amount of blood supply, so it warms the inspired air and moistens the inspired air. So warming of the inspired air, moistening the inspired air is also done by trachea because of the rich blood supply to the mucous membrane. The epithelial lining of the trachea is a respiratory epithelium. It is a pseudo-stratified ciliated columnar epithelium with goblet cell. The goblet cell produces mucus which traps the foreign bodies. The cilia beats upwards, that is towards the larynx. Once the phlegm is towards the larynx, the phlegm or the mucus, it is been coughed out. So that function of the trachea is, it propels the foreign body. It can be a dust, it can be any other foreign agents which enter the lower respiratory tract by the pseudo-stratified ciliated columnar epithelium with goblet cell. Goblet cell produces mucus which traps the foreign agent. The cilia beats upwards and thereby clearing the lower respiratory passage. So that is also a function of trachea. To summarize the function of trachea, it helps in transport of air in and out of the lung. It protects the lower airways. It warms the inspired air. It moistens the inspired air. And also, because of the lining epithelium, It traps the dust particle and the foreign agents and propels it because of the ciliated columnar, pseudo-stratified ciliated columnar epithelium with goblet cell. The cilia will propel the foreign agent upwards, thereby clearing the lower airways. This is the function of trachea. So in this video, we dealt with the anatomy and the physiology of trachea. Thank you for watching and learning from Logic Medico. If you like our video, kindly press the thumbs up icon and share this video with your other friends. Thank you for watching and learning in anatomy in the simplest possible way. Thank you once again.